Why do neurotransmitters matter for bladder control? Imagine your bladder as a busy communication hub, constantly sending and receiving signals to keep everything working smoothly. Neurotransmitters are the messengers that make this communication possible, especially when it comes to controlling when and how you urinate. They are essential because they help coordinate the complex dance between your nervous system and your bladder muscles, ensuring you can store urine comfortably and releases it when the time is right. Your bladder's ability to hold urine involves both the autonomic nervous system, which works automatically, and the somatic nervous system, which allows for voluntary control. Neurotransmitters carry signals between your brain, spinal cord, nerves, and the muscles of your bladder. For example, when your bladder fills up, sensory nerves send signals to your brain indicating fullness. This process involves neurotransmitters like ATP and glutamate, which help relay the message that it's time to go. When it's time to empty your bladder, the parasympathetic nervous system releases a neurotransmitter called acetylcholine. This chemical stimulates the detrusor muscle, the main muscle in your bladder wall, causing it to contract and push urine out. Without this signal, your bladder wouldn't be able to empty properly. At the same time, inhibitory neurotransmitters like gamma-aminobutyric acid and opioid peptides help keep the bladder relaxed during storage, preventing accidental leaks. Other players in this process include potassium channels, such as BK channels, which aren't neurotransmitters but are important for regulating nerve activity and muscle relaxation. If these channels don't work properly, it can lead to overactive bladder or incontinence, showing just how vital neurochemical balance is for healthy bladder function. The brain's central control centers constantly interpret signals from the bladder and send the appropriate responses through neurotransmitters. If this signaling gets disrupted, say, due to nerve damage or neurological conditions, it can cause problems like urgency, incontinence, or retention. That's why understanding how neurotransmitters work is so important for developing treatments for bladder disorders. In fact, many medications used to treat bladder issues target these neurotransmitter pathways. For example, drugs that block acetylcholine can help reduce overactive bladder symptoms, while others may enhance inhibitory signals to improve storage. All of this highlights how crucial neurotransmitters are for maintaining bladder health and ensuring proper urination. So, in essence, neurotransmitters are the tiny messengers that keep your bladder functioning smoothly. They help your nervous system communicate with your bladder muscles and sensory nerves, making sure you can store urine comfortably and releases it at the right moment. If this communication is off, it can lead to bladder problems, but understanding these processes opens the door to effective treatments. Always remember, if you have concerns about bladder health, it's best to consult a healthcare professional for personalized advice.